Good day. For today's video, we're going to discuss Health 10 Quarter 1 Module 1 Components of Consumer Health. Objectives. At the end of the lesson, the student should be able to 1. Define consumer health. 2. Give and discuss the three components of consumer health. 3. Apply the principle of consumer health to certain tasks. And 4. Value the importance of understanding the essence of consumer health to become a wise consumer. Consumer health. Consumer health is not just about buying health products and services. It is also about making decisions and having a clear and deeper understanding to make wise choices. It aims to develop a person's ability to evaluate and utilize health information, products, and services wisely and effectively. It is the study of products and services that have an effect on health and decisions on how to spend time and money. Components of consumer health. 1. Health information. 2. Health products. 3. Health services. Health information. It is any concept, step, or advice that various sources give to aid the health status of an individual. The type of information varies depending on various considerations such as, but not limited to, health history, drugs and alcohol consumption, and eating disorders. Example of health information: nutritional facts, ingredients, direction. Reliable sources of information. 1. Medical and health professionals. 2. Government agencies. 3. Websites ending in gov, edu, and org. 4. Local health officials. 5. Educational institutions. Unreliable sources of information. 1. Outdated customs, practices, and superstitions without scientific basis. 2. Information based on ignorance and prejudice. 3. Commercialized health information. 4. Personal options and incomplete information. 5. Quack or pseudo healers. Health products. Health products are food, drugs, cosmetics, devices, biologicals, vaccines, in vitro diagnostic reagents, and household, urban, hazardous substances, and or a combination of or a derivative thereof. FDA Act 2009. These products may be purchased from various places like supermarkets, pharmacies, and hospitals. Guidelines on the purchase of goods and services. 1. Evaluate which products and services will be beneficial, harmful, or useless. 2. Know the local laws and regulations that protect consumers. 3. Locate dependable medical, dental, and nursing services. 4. Apply knowledge acquired with respect to personal and environmental health in the purchase of personal goods and services. Some tips on how to be a wise consumer. 1. Gather correct and sufficient information. Get as much information by reading critically the details on the nutritional quality of the food. Be aware that being knowledgeable of the laws will protect you as a consumer. 2. Compare and contrast details of available products. Compare and contrast the products and services available before you purchase. Judge for yourself which among the products are most effective. You can use the questions in assessing the health information as your initial guide. 3. Inquire for more and review if possible. Ask direct questions from sales personnel if there are things about the product that are not clear to you before buying it. Clarifying things will make you more confident as a consumer. You can also get some information from other customers regarding the product. Health services. Healthcare services refer to the furnishing of medicines, medical or surgical treatments, nursing, hospital service, dental service, optometric service, and complementary health services. These are often connected to healthcare. These programs aims to appraise the health conditions of individuals through screening and examinations, cure and treat disorders, prevent and control the spread of diseases, provide safety, emergency care, and first aid, and ensure a follow-up program for individuals who have undergone treatments. Health services. These are usually offered by healthcare providers. A healthcare provider is a trained professional who provides people with healthcare. Health services are offered by health service providers. There are three types as follows: health professionals, healthcare facilities, health insurance. Health professionals. These are individuals who are licensed to practice medicine and other allied health programs and work in the medical profession. Examples: doctor, nurse, nutritionist, etc. Healthcare facilities. These are places or institutions that offer healthcare services. Examples: hospitals, walk-in surgery center, health center, extended healthcare facility. Health insurance. It is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. Health insurance. Philippine Insurance Corporation or PhilHealth. It is a government-owned controlled corporation created through Republic Act 7875, also known as the National Health Insurance Act of 1995. It aims to provide health insurance coverage for all Filipinos and ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. Classification of PhilHealth members: employed or members in the formal economy, employed or members in the informal economy, sponsored members, indigent members, lifetime member, senior citizens. For further understanding about the topic, let's have activity number 1. Let's go shopping. Directions. Write 5 examples of health products that people buy and consume using the web idea below. Write your answer in your activity notebook. Activity number 2. Let's dig more. Directions. From the products that you have identified in activity number 1, write the necessary information about the product. Copy the table below in your activity notebook. I hope you learned a lot from our lesson for today. Thank you for listening.